Hello, I am Juliana Mayorga to 2021 IWBNC. I am going to present surgical treatment in cervical spondylodiscitis. Spondylodiscitis of the cervical spine is uncommon, representing approximately 3 to 6% of all cases of vertebral osteomyelitis. In contrast with spinal infection in other vertebral segments, cervical spondylodiscitis can be an aggressive deteriorating process leading to early and severe neurological complications requiring urgent treatment. The primary treatment of cervical spondylodiscitis is a non-surgical approach with antibiotic therapy and external immobilization. However, the surgery is required in select cases with signs of biomechanical instability or neurological deficit. The surgical management involves debridement or descompression with or without instrument fusion using anterior-posterior recombinated approach. We conduct a retrospective review of patients presenting at Colombia University Hospital with cervical spine spondylodiscitis between 2017 and 2020. Neurological examination, imaging, and laboratory findings, type of treatment, and outcome were analyzed. A retrospective review of hospital inpatient records, including admission examination, was performed. Modified McCormick scale was used to determine the functional status. First grade represent totally functional patient, and fifth grade correspond to paraplegic or quadriplegic patient. A total of 7 patients were included. The most frequent complaint was cervical pain in 4 cases. 2 patients present moderate risk and 1 patient present high risk according to the Brighton Spondylodiscitis score. All patients with neurological deficit were taken to surgery. A pathogen was isolated in 6 patients and Staphylococcus aureus was the most frequent. 5 were male and the median age was 62 years. 2 patients present neurological impairment with HSC and D in 2 and 1 patient respectively. Empirical antibiotic treatment was initiated in all patients and 4 of them required redirection of antimicrobial therapy after pathogen isolation. This graphic represents C-reactive protein dynamics during treatment. In all cases, a significant decrease in CRP levels was recorded after the antibiotic therapy regimen was complete. In this graphic, we can observe a progressive decrease in the white blood cell count during antibiotic therapy. 4 patients received surgical management. An anterior cervical corpectomy with plate stabilization was performed in all of them. In addition, in 1 patient, an emergency laminectomy and descompression was performed due to progressive neurological impairment. Now I'm going to talk about one of the cases. A 41-year-old female with a medical history of systemic lupus erythematosus, epilepsy, anxiety disorder, and fibromyalgia came to our emergency department. She complained of 10 hours neck pain, motor disturbance, and urinary retention. The neurological examination revealed severe quadriparesis, Hoffman, and Tremor signs. An MRI with contrast showed retrolithostasis of C5, signs of spondylodiscitis at C5 and C6 levels, conditioning spinal stenosis and compressive myelopathy. In addition, an epidural abscess at C5 and C6 level was visualized. According to rapidly onset neurological deterioration and the presence of epidural abscess, the patient was taken to a laminectomy and descompression in a first surgical time. This is the postoperative MRI showing a successful epidural abscess drainage and the presence of myelopathy. Then, in order to treat retrolithostasis and spinal instability, the patient was taken to anterior cervical corpectomy with plate stabilization in a second surgical stage. These are the postoperative images showing anterior instrumentation of the cervical spine with a plate that screws between C4 and C7 level. Staphylococcus aureus was isolated in intraoperative culture, and we can observe in these graphics a progressive decrease in the white blood cell count and CRP levels during antibiotic therapy. Finally, no complications were registered in our study, no instrument diffusion failure. All patients had the same reversed modified McCormick scale after treatment, and all patients had the lowered white blood cell count and CRP levels after treatment. In conclusion, surgical management of cervical spondylodiscitis should be carried out in a timely manner in high-risk patients to reduce the risk of progressive neurological impairment. Instrument fusion was not associated with hardware failure or persistent infection in our cases. Thank you.